A new study says almost 15% of the world's population is living with mental disorders. Here to break it down and offer some sage advice for anyone looking to improve their mental well-being or to help others do so, we have Dr. Chloe Carmichael. She's a licensed clinical psychologist and the author of Can I Say That? Why Free Speech Matters and How to Use It Fearlessly. Great to have you with us today, Dr. Carmichael. Let's look at this study just out Saturday. It was published in the Lancet Medical Journal, and it found that the number of people suffering from mental disorders worldwide in 2023 had increased by 95.5% over the past 3 decades since 1990. If you could point to 2 or 3 main factors that you would identify as part of driving that trend, what would it be?
Sure, thanks. Thank you so much for having me. Whenever I see a study like this, I think when we look at the factors driving the results, it's important to look at the source. And this study was funded in part by the Gates Foundation. And so it's important to notice that one of the things that they highlighted as what would be helpful in their view was guiding people to focus on kindness instead of self-care. Now, that sounds fine when you think about it at first, except for from places like the Gates Foundation, I'm afraid that kindness is a code word for DEI, respecting people's quote pronouns, and the equitable math that the Gates Foundation has funded. And as a clinical psychologist, I actually think that those things are eroding our mental health more than anything. And I think this is even shown in the regions of the world where they say that these spikes are the greatest. They're looking at places like Western Europe, where free speech is actually the most in jeopardy.
Fascinating. And to this point, self-care is becoming more and more of a trend as people try to, I suppose, grapple with this growing amount of mental discomfort and disorders. But the institute whose researchers led this particular study have said that high-income regions such as Western Europe and Australasia recorded some of the highest mental disorder burden rates globally. That included countries like Portugal, Australia, and the Netherlands. Is that part of what you would identify as why those countries are in this more densely identified part of the study?
Yes, because those areas with that higher income are also correlated with higher levels of education, which means, unfortunately, in this day and age, higher levels of being steeped in academia that is brewing with the very types of things that I think are actually eroding our resiliency. So this is the same type of environment that will tell you that words are violence, or that, you should cut off family members that are, maybe in disagreement with you politically. It's oftentimes the same environment that's, preaching this, they call it body acceptance. And it's, the same place that's turning out doctors that will tell you that it's perfectly fine to be, as they say, fat, that fat acceptance, even though the study itself cited heart disease and strokes as some of the major risk factors. As a clinical psychologist with my new book, Can I Say That? Why Free Speech Matters and How to Use It Fearlessly, I'm promoting that people should have real talk. They should be able to have strong, resilient relationships with people that disagree with them. We know social support is very important for health. We also know that physical fitness and even religiosity are great protectors of mental health. But I always look at the source. And when we look at studies that talk about these sky-high numbers of, mental health issues, unfortunately, I also wonder if there's a desire to medicalize and monetize the human condition. And instead of, again, looking at the factors in these societies where these numbers are spiking, instead of saying, gee, I wonder if all this DEI and telling people that they have to smile and pretend that a man can become a woman and welcome him into their locker room, maybe that's taking a toll on the mental health of this population. But I don't see that. I see them saying, quote, kindness needs to help. And again, I think in many cases for them, kindness is a code word for politically correct and the very things that might even be doing the most harm.
Yeah, and you pointed to a really interesting phenomenon, this estrangement trend, where families are seeming to unravel, or the things that bind us all together are becoming less certain. In your book, I know you offer some very practical ways that people can forge those relationships through conflict, or perhaps despite conflict. If you could give our viewers some of those approaches that you've seen work particularly well to deal with the mental discomfort that comes with that.
Oh, thank you so much. Yeah, and if anybody wants, I'm glad to pop into their book club virtually or anything. I love to talk about this topic. So the book emphasizes not only the importance of speaking up, and there are practical ways that you can do that. Maybe have a mock role play with a friend before you're going to go into a speak up situation, or if you want to speak up at a college, university, maybe check their university handbook so that you know the policies and you can quote them back to the professor if things get heated. But the book also has a lot of practical techniques for listening well, because listening is also, of course, an essential part of open dialogue. And sometimes that can just mean simply repeating back what the other person has said, even if you disagree with it, instead of trying to get your word in edgewise. To be, when they say what they say, just say, okay, I want to make sure I really hear you. So you believe X, Y, and Z for reasons A, B, and C. Did I get that right? And once people feel that you're truly listening and giving them the floor, then you can say, would you be interested in my view, and see if they can repeat it back? Because when our heart rate goes above 100 beats per minute, we're really not even thinking clearly, and we are not comprehending. And that's how people end up talking past each other.
So great to hear your insights on this. Thank you so much, Dr. Chloe Carmichael.
Thanks for having me.